Let's bring in Catherine Bennett, Professor in Epidemiology and Chair in Epidemiology at Deakin. Thanks for your time. Are you feeling a bit more optimistic after the briefing today, Professor Bennett? What's your overall view on where Victoria is at?
Yes, Kieran. Look, I do think it's a remarkable story of both public health response, so the detail they have on these cases and how quickly they pull that together, and the public response. You know, as you said, the testing is fantastic, and that's what's going to actually make the big difference here to help build confidence that we're not missing more cases. It's important to note that where they are linking cases, even when they're talking about people brushing past each other and, you know, stranger to stranger transmission, these are still associated with known venues. So that's good news. So we know that someone in the Telstra store who was there for a while or in that display home might be at risk. But also, it still makes that general testing really important because they don't know those people by name. They can't chase them up. They're relying on the public to come forward. So that's why that public testing rate is so incredibly important to really build confidence that everyone who might have been exposed is heeding those calls, is coming forward and being tested and ruled out as a case.
And Professor Bennett, those numbers, that comparison that my colleague Tom Connell put together versus lockdown 2, this lockdown and the scenario when it comes to unknown cases or unknown sources for cases, this is a much better outlook right now than it was last year.
Look, that's right. And I think the other thing to remember is that, you know, we didn't have, and Jerome was saying this today, our contact tracing commander, you know, we had nowhere near this level of detail on cases in the second wave, certainly not in those early stages where it was taking off and had already got ahead of our contact tracing. So we're now in a great position because of this detective work to actually see exactly where the virus is, where people are moving around in the time when they were infectious, and how this comes together with new cases that are being reported. So we've had a couple where people haven't been in quarantine at the time they were tested because they were identified through these sites, came forward tested and isolating then. But at the same time, you know, we had over 10%, 12% of our cases were mystery cases in wave 2. People thought, oh, that's people not getting tested, that's asymptomatic cases. But it would have also been these links that you just couldn't make because we didn't have check-ins, we didn't have the detailed forensic follow-up of exposure sites that we have now. We didn't have any exposure sites called out in the second wave until right towards the very end. So I think actually those more casual exposures that are being found, those links being proven through this detective work is actually always a concern because we know the virus can move that way, but actually really a reassuring story about how efficient and effective our contact tracing is at the moment.
Yeah, so that's the question. Last time we spoke about the testing story, and that's much better, double the number of tests. This contact tracing, the Victorian system and the authorities copped a lot of flack last year. That has improved by how much?
You couldn't compare the systems. You've got a 2,400 strong workforce. We routinely go to not just contacts when we find a case, but their contacts as well, and we quarantine them straight away. That takes a lot of work to identify them, to quarantine them, and to release them if that intermediary case isn't positive, but that's what they're doing. No other state tries to do that. In this outbreak, when they realised, you know, we're working on cases that were up to 2 weeks old when it first appeared and identified through testing, they actually were going to a third ring as well. So that is actually a massive effort, and it's a test of a contact tracing system. And the fact that they were doing that, 3 rings of follow-up within 24 hours tells us that the system is really robust and that it's up to it. So that's important. You know, we want to mop this up now. We want to use this lockdown really effectively to make sure we've got it all. But equally, I think, you know, that reassurance we have about the quality of our contact tracing is something we'll take away from this outbreak too.
Professor Bennett, just finally, the question that all Victorians are asking, will the lockdown be continued? Will it extend into next week? And if so, is there a scenario where they say, OK, we're going to extend it for 7 days, potentially lifting it earlier than that as well? What's your best guess at the moment?
Oh, it will depend on tomorrow's cases, not the numbers, but the profile. If it continues where they're seeing, as they have been, more and more of them in quarantine, if we're not getting any more heads up of worrying sites, if they've really now confident about those links, which they're already starting to see between the aged care cluster and the broader network, if that all continues, then hopefully we might see the lifting of restrictions on Thursday night, but with expect to see ongoing restrictions, and that might be, masks all the time indoors, still strong limits on household gatherings, and so on. So I think there will be a legacy for a few days beyond this. If it has to be a lockdown, it probably, unless things in regional Victoria change, but they've been looking good, it probably would really be focused on the metro area. If it had to continue, then they might just need to ask to do this until Sunday. But even then, they could have some easing without really compromising safety. So you might not need the 5-kilometre rule. You might not need to wear masks outdoors. There might be things that they can relax a little bit, even if they do have to keep a lid on this for a little bit longer to ensure that they've wrapped up the outbreak.